ఇది కొంచెం పైకి పెట్టండి. ఇది పైకి పట్టుకోవచ్చు. Morning students. Today we are going to discuss about the kidney, ureter and posterior abdominal wall silent features. Okay, it's not possible to discuss three broad topics within 1 hour, but I try to convey useful message. Okay. First, we take about the kidney. Kidney, it is a essential organ of excretion, and it also performs endocrine function. Okay, that is excretory function. That is by the elimination of end products of protein metabolism, especially the creatine, urea, uric acid, and some other products. At the same time, it also maintains the fluid balance and electrolyte balance. Fluid and electrolyte balance and excretion of waste products. These are the two most important functions of the kidney. Apart from this, it also performs endocrine function. That is, it produces the renin hormone. It is very important for the maintain the blood pressure, and at the same time, it also produces hemopoietin or erythropoietin. And it is a hormone. It stimulates the bone marrow, especially red bone marrow, to produce the red blood cells. And another important function is it also produces 1,25 hydroxycholecalciferol. It is a hormone. It regulates the calcium metabolism along with the parathormone. It regulates the calcium metabolism. Okay, these are the basically most important functions of the kidney. That is, one is the excretion, and another one is the maintenance of electrolytes and fluid balance, and number 3 is the endocrine function. To perform all these functions, the kidney is having a specialized arrangement of structures. They are performing different functions. First, there is a pair of kidneys, right and left kidney. And what is the location of the kidney? That is, they are paravertebral in location. In the posterior abdominal wall, and especially these are the retroperitoneal organs. That is the right and left kidneys. That is at which level of the posterior abdominal wall they are located? That is from T12 to L3. In between the T12 and L3, that is, it extends. The kidney upper pole extends up to the level of the T12, and the lower pole extends up to the level of the L3. In between these vertebrae, that is the location of the kidney. And here, the axis of the kidney is also very important, because it is not a straight or it is not a horizontal. It is oblique. It is not a straight horizontal like this. It is not straight like this. It is oriented. The axis of the kidney is also very important, because it is like this, straightly oblique. The upper end is close to the vertebral column when compared with the lower end. Our upper pole is close to the vertebral column than the lower pole, and the surface also, the anterior surface and posterior surface, they are not like this flat. They are tilted. That means the anterior surface of the kidney, it is directed forwards and laterally, and the posterior surface is directed backwards and medial. That means it is not like this. It is like this. Okay, tilted. Okay, along with the paravertebral gutter. Okay, that is the axis of the kidney. And next, coming to the size of the kidney. The size of the kidney clinically it is very, very important because if you go for the radiology, in the ultrasound scan, ultrasound abdomen, you're supposed to mention the size of the kidney. That is very, very important because if there is an increase in the size of the kidney or decrease in the size of the kidney, both are clinically important. Suppose if there is an increase in the size of the kidney, it may be due to polycystic kidney or it may be due to hydronephrosis. Or suppose if there is a decrease in the size of the kidney, it may be due to obstruction to the kidney blood flow. That is stenosis of the renal vessels, especially renal artery stenosis. That is why this increase in the size of the kidney and decrease in the size of the kidney both are important clinically. Because of this reason, you must know what is the normal size of the kidney. That is, suppose you take each kidney that is about 11 centimeters in length, 11 centimeters in length, and 6 centimeters in breadth, 6 centimeters in breadth, and 3 centimeters in thickness, 3 centimeters in thickness. That means 11 into 6 into 3. This is the normal size of the kidney. You must know. It is very, very, very important. The normal size of the kidney. If you know the normal size of the kidney, then only you can diagnose whether it is a normal or abnormal. Without knowing the normal size of the kidney, not only for the kidney, normal size of the heart, normal size of the liver, normal size of the ovary, normal size of the uterus, normal size of the spleen, all these normals are very, very important. Here also, normal size of the kidney is also very, very important. That is, its length is 11 centimeters, breadth is 6 centimeters, and thickness is 3 centimeters. That is the normal size of the kidney. And the weight of the kidney varies depending upon the body size of the individual and sex also. That is male and female. That is, suppose if you take the male, the range of the kidney weight is 150 grams to 170 grams in males. If you take the females, the weight is 130 to 150 grams. 130 to 150 grams. Okay, that is the size and weight of the kidney. And location of the kidney, you know, and the shape of the kidney is bean shaped. Already know since your school days you are studying size of the kidney, shape of the kidney. That is a bean shaped structure. Next, movements that usually the kidney moves. Kidney moves along with the respiration, along with the movements of the diaphragm. It is because it is below it is attached to the diaphragm to a ligament. It is attached to the ligament diaphragm. Because of this reason, along with the respiration during the movements of the diaphragm, kidney also moves. Kidney also moves. Usually in quiet respiration, that is, it moves for about 1.5 centimeters. In deep respiration, it may move up to the 2.5 centimeters. 2.5 centimeters. That is the normal range of movement of the kidney during the respiration. Okay, next coming to the palpability. Usually you are unable to feel the kidney. Usually you are unable to feel the kidney. Okay, the kidneys are a pair of essential excretory organs which elaborate urine and nitrogenous waste products of the protein metabolism from the blood and maintain the electrolytes and water balance of the body. Okay, here these are the two kidneys. You see, this is the right kidney and left. Sorry, one more point is important. Here, the right kidney is slightly in the lower level than the left kidney. That is also very, very important. The right kidney is slightly in the lower level than the left kidney because already you know the right hypochondriac region is occupied by liver. It is a heavy organ in the right hypochondriac region. Because of this reason, the right kidney is slightly in the lower level than the left kidney. Suppose if you take the vertebral level, suppose if you take the posterior relations of the kidney, that is the right kidney is related with the 12th thoracic, the 12th rib. But in the left kidney, it is related with the 11th and 12th ribs. 11th and 12th ribs. That is why it is slightly in the lower level than the left kidney, and right kidney is broader, and left kidney is narrower and longer. Narrower and longer. These are the differences between the right kidney and left kidney. And usually there are two notches in the hilum of the kidney in the right side. but in the anterior border, in the anterior lip of the hilum. But here in the left kidney, there is only one notch. One notch. That is that these are the differentiating points. And at the same time, the left renal vein also receives the suprarenal vein, and they from below, from above, and from below it also receives the left gonadal vein. These are the points to differentiate right kidney and left kidney. Okay. The next factors keeping the kidney in position. That is also very important. Factors which are keeping the kidney in position, that is surrounding viscera and the blood vessels which are connected with the kidney, and the fascia which is covering the kidney. That is the renal fascia. Renal fascia, it also keeps the kidney in position. Okay, these are the kidneys. Next, another important thing, coverings of the kidney. This is also important. The kidney is covered by some structures, that is, there are coverings. First, innermost covering is inner capsule. That is the true capsule of the, or fibrous capsule of the kidney. Fibrous capsule or true capsule of the kidney. It is nothing but the condensation of the fibrous tissue of the gland. It is nothing but the condensation of the fibrous tissue of the gland. It produces a capsule that is called true capsule or fibrous capsule. Fibrous capsule. Okay. And next, this capsule is very, very important because it is the structure. It also extends along the pelvis and minor calyx, major calyx, and pelvis of the That is why this is the true capsule or fibrous capsule. And outside this fibrous capsule, there is a fatty layer that is called perinephric fat. Perinephric fat. You see here, this is the kidney, and this is the true capsule or fibrous capsule. And outside this is the perinephric fat. Perinephric fat. This perinephric fat is more in the hilum. This area is called renal sinus. This area is called renal sinus, and this area is loaded with fat. Apart from this, that is also surrounding the kidney. This is the perinephric fat. Perinephric fat. And outside this perinephric fat, another layer, that is the renal fascia. Renal fascia. This is the fibrous fascia, and this is the renal fascia. Renal fascia. This is called false capsule. This is the true capsule. Fibrous layer is the true capsule, and the outside layer is the false capsule. That is nothing but the renal fascia. Renal fascia, and it is surrounds the kidney. And here the anterior layer and posterior layer. The anterior layer continues with the outside opposite layer of the this renal fascia, and posterior layer it is attached to the, there is a psoas fascia. Psoas fascia. Laterally it is a continuous as the fascia transversalis. Fascia transversalis. Okay. This is the another fascia, that is renal fascia. And outside this renal fascia, there is another layer, that is the paranephric pad of fat. Paranephric pad of fat. Total, there are how many layers? There are 4 layers of coverings of the kidney. 4 layers of coverings of the kidney. First one is the fibrous capsule or true capsule, and next is the fatty layer, that is the perinephric fat. And next is the renal fascia, and outside this another one layer is the paranephric fat. The paranephric fat, it is more abundant in the posterior and lateral part of the kidney. Posterior, especially the posterior part of the kidney. And all these fatty layers, they are liquid in the form at the body temperature. They are in the liquid form at the body temperature. Because of this reason, they act like a shock absorbers. They protect the kidney. They protect the kidney from the external injuries. Okay, that is the most important function of this fat present in the surrounding the kidney. Surrounding the, okay, that is very, very important. And this layer. Next here, another important thing. You see here, this is the fibrous capsule, and this is the perinephric fat, and this is the renal fascia. And you see here the paranephric fat, it is more abundant in the posterior part of the kidney, or posterior surface of the kidney. Okay, this is the kidney. Next, the kidney. What are the parts of the kidney? That is also very important. Each kidney, it is having. You see here, this is the kidney. This is the upper pole, and this is the lower pole. What you are seeing, this is the anterior surface, that side posterior surface, and this is the lateral border, and this is the medial border. At the medial border, there is one depression that is called hilum of the kidney. Hilum of the kidney. This hilum of the kidney also enters into the kidney. That is called renal sinus. Renal sinus. Renal sinus. Okay. These are all the different parts of the kidney. How to determine the side of the kidney is also very important. Here, the anterior surface is convex. Anterior surface is convex. The posterior surface is almost flat. Posterior surface is almost flat. And another important thing, the anterior lip of the hilum of the right kidney is having two depressions, two notches. That is due to the segmental development of the kidney. Segmental development of the kidney. There are two notches. But if you take the left side, it is having only one notch. The left kidney is having only one notch. But here, the right kidney anterior lip is having two notches. Okay, and another important point, the right renal vein it is shorter when compared to the left renal vein. And the left renal vein also receives from above suprarenal vein, from below gonadal. These are all the differentiating points. And apart from these, the arrangement of the structures are also important. In the hilum, with the three structures they are arranged. That is valve. That is anteriormost is the vein. Next is the artery. Next is the ureter. That is the pelvis of the ureter. These are the structures arranged in the hilum of the kidney. Okay. And here, a very important thing, relations of the kidney. Relations of the kidney is very important. Relations of the kidney, suppose if you take the posterior surface of the kidney, that is the right kidney is different from the left kidney. First, it is the relations of the posterior surface of the kidney, we divide into two parts, that is upper relations and lower relations. Upper relations and lower relations. You see here, this is the posterior surface of the kidney, and the upper relations, these are the upper relations, these are the lower relations. The upper relations are, first this is the diaphragm, okay, diaphragm, and inside the diaphragm there is posto-diaphragmatic recess of the pleura, and 11th and 12th ribs, and intercostal muscles, 11th and 12th ribs. That is the left side 11th and 12th ribs, the right side only 12th. Okay, in the right side only 12th rib, but in the left side 11th and 12th ribs. These are the upper relations of this one. Next, coming to the lower relations. These are the lower relations. That is, the lower relations are from medial to lateral. That is, there are muscles. That is, psoas major muscle. That is, next is the quadratus lumborum muscle, and these muscles they are also covered by fascia. That is, psoas muscle is covered by psoas fascia, and the quadratus lumborum muscle is covered by the anterior layer of the thoracolumbar fascia. And paranephric fat. Next, these vessels, that is these structures, that is subcostal vessels and nerve. And below that there is a iliohypogastric and iliojuvenile nerves, and muscles and fascia. These are all the posterior relations of the kidney. Here, the posterior relations of the kidney is very important, because if you want to approach the kidney, usually we approach the kidney from the posterior aspect of the posterior abdominal wall. Because of this reason, the relations of the posterior relations of the kidney is very important. Here, if you want to approach the kidney, you must give an oblique incision along the lower border of the 12th rib, along the lower border of the 12th rib. Because of this reason, the counting of ribs is very, very important. Counting of ribs is very, very, very important. You must identify the 12th rib, not the 11th rib. Because up to below the level of the 11th rib, there is extension of the pleural cavity. You see here, this is nothing but the pleural cavity. That is nothing in the form of postdiaphragmatic recess. And if there is if you give incision at this level, if you cause damage to this pleura, this parietal pleura, and it produces respiratory embarrassment, the person may develop severe dyspnea and they may die. Because of this reason, the identification of the 12th rib is very, very important clinically and surgically. During surgery, you must be very careful because if sometimes the 12th rib may be very short and you may, by mistake, you may calculate the 11th rib as a 12th rib. If you give incision and if you go into this pleural cavity, it is a very, very dangerous clinical condition. That is why the posterior relations of the kidney are very, very important. Very, very important. Okay. Next, anterior surface. Anterior surface of the kidney is convex and it is also related with some structures. The anterior surface is also related with some structures. What are the anterior relations of the kidney we see? And here, the anterior relations of the kidney is right kidney is different from the left kidney. Left kidney is having some relations, right kidney is having some relations. Suppose if you see the right kidney, if you take the right kidney, there are 6 areas. This area it is related with the suprarenal gland, and this area related with the there is a liver, hepatic area, and this is the duodenal area, and this is the colic depression, right colic axis. It is related with the this area of the anterior surface, and this small area it is related with the jejunum. So out of these 6 areas, 2 are peritoneal, that is hepatic and jejunal areas. These are the peritoneal relations. It is covered by greater sac peritoneum, greater sac peritoneum, greater sac peritoneum, and that is these are the 6 relations, anterior surface. If you coming to the left kidney, the relations are here also 6, but it is different. That is, if you see the suprarenal gland, it is coming towards more towards the medial border of the kidney, medial border of the kidney, because the left suprarenal gland it is half moon shape, lunar shape. That is why it is more related with the medial border of the upper pole of the kidney, not like the right side. Okay, next it is also upper pole. It is related with the spleen. This is the splenic area, and this is the gastric area. It's also related with the stomach. This is related with the spleen. This is related with the suprarenal gland. And here, this middle area, along with the hilum of the kidney, anterior surface, is related with the pancreas, tail and the body of the pancreas, tail and body of the pancreas. And lower part is related with the, this area is related with the jejunum, and this area is related with the colic. That is a left colic flexion. Left colic flexion. Okay. These are the areas which are having relation with the anterior surface of the kidney. Anterior surface of the kidney. Out of these, the left kidney is having some interesting points. Some interesting points. That is, here anterior relations of the left kidney, 3 are peritoneal, 3 are non-peritoneal. See, that is a splenic area, gastric area, and jejunal area. These are peritoneal. The remaining 3 are non-peritoneal. Okay, that is one point. Next, in between the splenic and gastric areas, there is one attachment of a ligament, that is a lienorenal ligament. Okay, that is an important point. Next is 3 glands are coming in contact with the anterior surface of the left kidney. That is, one is the spleen, next is the suprarenal gland and pancreas. Suprarenal gland and pancreas. And 3 parts of the gastrointestinal system, that is foregut, midgut, and hindgut. 3 parts are coming in contact with the anterior surface of the left kidney. That is, first is the gastric area, that is a part of the foregut, and next is the jejunal area, it is a part of the midgut, and the colon is a part of the hindgut. So these are the interesting points of relations with the anterior surface of the kidney. Okay, these are the different relations of the anterior surface and posterior surface of the kidney. Okay, and here upper end, it is rounded, and it is 2.5 centimeters away from the midline. Upper end is 2.5 centimeters away from the midline. That is, you see here. This is the, suppose if you take this midline, this is upper end, it is related with the 2.5 centimeters away from the midline. You see here, this is the left kidney, it is related with the 11th and 12th ribs. But here the right kidney is related to only 12th rib, not the 11th rib. Here, that is the distance from the midline to the upper pole of the each kidney. And the hilum of the kidney, it is about 5 centimeters away from the midline. 5 centimeters away from the midline. And the lower pole is about 7.5 centimeters. So 7.5 centimeters away from the midline. That is why the kidney is not like this. The kidney is oriented like this. So this is the upper pole, middle, and lower. Okay, that is why there is a difference in the distance of the upper pole hilum and the lower pole from the midline. Okay, that is the another important point. And the medial border, there is a specialized area that is nothing but the hilum. That is the hilum. In the hilum, within the substance of the kidney, if you take the coronal section of the kidney, it is the substance of the kidney is divided into two parts. That is, one is the renal substance, and next is the renal sinus. The renal sinus, it is a cavity, it is empty area. It is filled with fat, and it also filled with the blood vessels and ureter and lymphatics and some lymph nodes. Okay, and these are nerves and lymphatics. Okay, that is the renal sinus. Renal sinus. You see here. This is the area called renal sinus. Renal sinus, and this is the substance of the kidney. This is the substance of the kidney. Here, the renal sinus, renal substance. Suppose if you take the renal substance, the substance of the kidney, again it is divided into two parts. That is outer cortex, inner medulla. Outer cortex, inner medulla. Okay, and this cortex and medulla, again here in the medulla, that is, it is divided into two parts. That is renal pyramids and renal columns. Right? In between the areas between the renal pyramids, we call it as renal columns. Okay, these are the renal columns. These renal pyramids, they are conical in shape, and they open into the minor calyx. They open into the minor calyx. There are about 7 to 13 minor calyx, and 2 to 3 minor calyx together they form the major calyx. And 2 or 3 major calyx together they continue as the pelvis of the ureter. Pelvis of the ureter. Okay, these are all the different structures. And at the same time, there are blood vessels, especially the arteries which are supplying to the kidney, that is renal artery. Immediately after entering into the hilum of the kidney, the renal artery divides into two, anterior and posterior trunks. Anterior and posterior trunks. The anterior trunk again it divides into lobar branches. Lobar branches. That is, and again the lobar branch, from the lobar branches there are interlobar branches, and from the interlobar, this is the interlobar branch, and this is the from the interlobar branch again it divides into two branches, that is arcuate branches, arcuate arteries. From the arcuate arteries there are straight arteries, they are nothing but the interlobar arteries. This is the lobar, interlobular. This is the interlobular. From this interlobular artery only there are afferent arteriole, and it goes to the glomerulus, and it is meant for the filtration. This is the arrangement of the blood vessels within the substance of the kidney. This arrangement of the renal arteries, there is the different levels. That is the first renal artery. It is a branch of the abdominal aorta. Usually 1 liter of blood circulates to the kidney per minute. Per minute, there is 1 liter of blood loss to the kidneys per minute. Okay, and sometimes there may be chances for the accessory renal arteries. Accessory renal arteries may present because the kidney develops in the lobula. Okay, like this, there are different levels of arteries division, and afferent arteriole and efferent arteriole. Here, usually during filtration, afferent arteriole diameter is more when compared with the efferent arteriole. Because of this, there is a pressure gradient, that is 45 millimeters of mercury pressure is built up. So this is the called filtration pressure. This is called filtration pressure. And within the substance of the kidney, again there is another arrangement. There is a peritubular network. Peritubular network. This is the low pressure system. Low pressure system. It is meant for the tubular reabsorption, selective reabsorption. Because of this reason, there are two circulations. One is the major circulation, another is the minor circulation. First one is the high pressure circulation. Second one is the low pressure circulation. Okay, this is the arrangement of the structures within the kidney. You can go through the kidney in detail because by lack of time, I am touching only some points. Okay. Next, the renal arteries is especially the interlobular and the segmental arteries. They are end arteries. They are end arteries. If there is a blockage of this artery, it won't be. There is no anastomosis. You see here. This is different. This is different. Only this segment is supplying this artery, and this segment is supplying by this artery only. There is no anastomosis between the arteries within the substance of the kidney, but there is anastomosis. There is a fluxus formation between the veins. That is the very, very most important difference between the arteries and veins. That is, veins are communicated with each other, but arteries which are supplying to the substance of the kidney, they are not communicated with each other. Each segment of the kidney is having its own blood supply. Okay, and here you see these are the arteries, typical branches. Okay, these are all the segmental branches. Okay, each segment is supplied by one branch. Okay. Next, the kidney is also divided into different segments, just like our lungs. This is the apical segment, this is the upper anterior, this is the middle anterior, and this is the lower segment, and this is the posterior segment. Okay, you see here. In the lateral view, this is the posterior, this is the upper anterior, lower and upper segments of the kidney. Upper segments of the kidney. Okay, that is about the detail about the kidney, and that is coming to the clinical aspects. That is the renal stones. That is the most common clinical problem. And in kidney stones, there is a radiation of pain from loin to groin. This is very, very important clinically. Why it is there is a radiation of pain from loin to groin? Loin to groin, because the kidney, it is receiving its nerve supply from the, that is from sympathetic nerves, that is from the T10 to L1 segments of the sympathetic chain. T10 to L1 segments of the sympathetic chain. These segments, they supply the anterior abdominal wall below the level of the umbilicus and below the level of the umbilicus, up to the groin. That is why during the renal caliculi, during kidney pain, it is radiating from loin to loin to groin. That is the important. Next, there sometimes there will be some congenital abnormalities of the kidney. That is a horseshoe kidney, polycystic kidney. Okay, and sometimes if there is an injury to the kidney, usually the outer part of the kidney is more functional than the inner part of the renal substance. That is high pressure. Suppose if there is any crush injury to the kidney, it is a shutdown of the outer part of the kidney function. It is a low pressure gradient may activate, and it is unable to filter the blood, and it leads to that is a clinical condition that is called crush syndrome. Crush injuries of the kidney. Crush syndrome. That is the another important. Next, here another important clinical point. You see here along this line. This is the avascular line, because there is no anastomosis between the blood vessels of the kidney supplying the anterior segments and posterior segment. And this is the clinically this is the avascular segment, and this is called Brodel's line. Brodel's line. This line, it is clinically it is useful to give incision along the kidney. Along this line, you can give incision to remove the kidney. That is to remove the hedgehog stones of the kidney, or to some if you want to enter into the kidney. This is the common line. Okay, but here it is not clearly 100 absolutely it is not avascular, because the veins may be anastomosed with each other. Because of this reason, it is less vascular. That is also another important clinical point related with the kidney. And kidney abnormalities, there are sometimes there may be a single kidney with the two ureters, and depending upon the position, sometimes there may be pelvic kidney. Okay, in the pelvis maybe kidney may be accommodated. Like this, there are different variations in the, and it is also very important to maintain the blood pressure. Suppose if there is a stenosis of the renal artery, it leads to decreased blood flow to the kidneys, glomeruli, there is no proper filtration, and it leads to increased angiotensin levels, and it produces increased blood pressure. Increased blood pressure. If there is a stenosis of the renal artery, usually we anastomose this renal artery, the distal part of the stenosis with the splenic artery to maintain the blood pressure. Okay, that is also very important. These are all the points in brief about the kidney in any further study in detail. Okay. Next, coming to the other topic, today's topic is ureter. Ureters are a pair of thick-walled cylindrical tubes. They are made up of fibromuscular tissue. The cylindrical tubes which convey urine from the corresponding kidney to the urinary bladder. Each kidney is about each ureter is about 25 centimeters long and 3 millimeters in average diameter. Okay, each ureter is about 25 centimeters long and 3 millimeters in average diameter. Okay, and it starts from the hilum of the kidney to the urinary bladder. The length of the ureter is 25 centimeters. The caliber is 3 millimeters. Average. So in some areas it may be more, in some areas it may be less, but the average is 3 millimeters. This is very important. Next, coming to the what are the different parts of the ureter? It is the ureter. It is divided into 3 parts. That is pelvis of the ureter, abdominal part of the ureter. Okay, pelvis of the ureter, abdominal part of the ureter, and the intramural part. That is the pelvic part of the ureter. Okay, pelvis of the ureter is different from the pelvic part of the ureter. Pelvis of the ureter means that is the initial starting point of the ureter. You see, from phylum of the kidney up to the lower pole of the kidney, up to this level, this is the pelvis of the kidney. From here up to the pelvic brim, up to the level of the pelvic brim, this part is called abdominal part. The remaining part is the pelvic part of the ureter. Like this, the pelvic ureter is divided into 3 parts. That is the pelvis of the ureter, abdominal part, and pelvic part of the ureter. Okay, these are the 3 subdivisions of the ureter. And next, first you see about the pelvis of the ureter. Pelvis of the ureter, it is formed by the union of the minor calyx. Together they form the major calyx, and these major calyx, you see here, these are the minor calyx. Together they form the major calyx. These major calyx together they form the pelvis of the ureter. This is the pelvis of the ureter. The capacity of the pelvis of the ureter is 5 to 7.5 ml. From here to here, we call it of the pelvis of the ureter. Next is the another part, that is the abdominal part. Abdominal part passes downwards retroperitoneally. Behind the peritoneum it runs downward side slightly medially. Behind the peritoneum. This is the abdominal part, and it ends at the pelvic brim. Then it continues as the pelvic part of the Here, what are the relations of this pelvic abdominal part of the ureter are very important. And posterior relations, that is, if you see here, this is the psoas major muscle. Sometimes it will be psoas minor muscle. Sometimes it will be psoas minor muscle. Okay. Next, fascia, which is covering the psoas major muscle. And here is anteriorly it is having behind this there is a genitofemoral nerve. Genitofemoral nerve it also passes behind this abdominal part of the ureter. And coming to the anterior relations, of this ureter, they are different from the right and left. That is, right and left relations are different. That is, first of all, you take right kidney. That is, first one is the right peritoneum, then right gonadal vessels. These are the right gonadal vessels. And next is the second part of the duodenum. Second and third parts of the duodenum also related in the upper part. Okay, second and third part of the duodenum. And next is the right colic and ileocolic branches of the superior mesenteric artery. Right colic and ileocolic branches of the superior mesenteric artery. And next is the root of the mesentery. At this level, there is a root of the mesentery and terminal part of the ileum. That is files of the ileum. Terminal part of the files of the ileum is also related with the abdominal part of the right ureter. If coming to the left side, same, that is peritoneum and the left gonadal vessels. Left gonadal vessels. Here the vessels, under vessels, that is left colic artery branches, that is left colic and sigmoid branches. Left colic and sigmoid branches of the inferior mesenteric artery. Left colic and sigmoid branches of the inferior mesenteric artery and apex of the V-shaped sigmoid mesentery. Apex of the V-shaped sigmoid mesentery. These are the structures which are related with the anterior surface of the pelvis of the ureter. Anterior surface of the abdominal part of the ureter. Then it continues as the pelvic part of the ureter. Then it enters to the pelvis. Then it enters, you see here, this is the pelvis of the ureter up to here. This is the abdominal part. These are the relations. This is the posterior psoas major muscle. And this is the genitofemoral nerve. Genitofemoral nerve. And these are the blood vessels which are having anterior relation. That is ileocolic and left colic and sigmoid colic. Sigmoid colic branches. These are the left, this is inferior mesenteric part. Okay, this is the superior mesenteric artery. These are the branches. Okay, this is the right ureter. This is the left ureter. Okay, next, then it continues as the pelvic part. Pelvic part of the ureter. You see here. Here, this is the pelvic part of the ureter. Pelvic part of the ureter. The pelvic part of the ureter, again, it is divided into three parts. That is, first one is the vertical part, or first part, then horizontal part, then intramural part. It is divided into three parts. Vertical, you see here, this is the vertical part, this is the horizontal part, then within the substance of the, that is wall of the urinary bladder, there is another part, that is, this is the urinary bladder. Okay, within the substance of the urinary bladder, this is the another part, third part. Okay, this is the pelvic part of the ureter. It is divided into three parts. This is the vertical part, this is the horizontal part, second part, this is the intramural part, intramural oblique part, intramural oblique part. First, what are the relations of these different parts is also very important surgical. Okay, if you go to the surgical department, you must be very careful with that, especially during hysterectomy. During hysterectomy, you must be aware of the position of the ureter. Otherwise, you may cause damage to the ureter and it leads to its own complications. That is why you must be very careful with the ureter, especially the pelvic part of the ureter. Pelvic part of the ureter. Here, this is the vertical part, this is the horizontal part, and this small one is the intramural part. Intramural part. Here, the vertical part relations are first part of the pelvic part of the ureter related with the anteriorly with the ovarian fossa and broad ligament. Okay, and posteriorly related with the iliac, common iliac and internal iliac vessels, and laterally it is related with the obliterated umbilical artery. Then there is a pudendal vessels and now pudendal vessels and now, and this is the inferior mesenteric, inferior vesical vein, and middle lactal vein, and uterine vein, artery, uterine artery, inferior vesical artery, middle lactal artery. These are all the branches which are having lateral relation with the ureter. First part of the pelvic part of the ureter. Okay, medially it is covered by peritoneum. It is covered by ureter. And then this is the horizontal part. The horizontal part of the ureter is also very important during hysterectomy because this is the area it is closely related with the uterine artery and broad ligament of the uterus and below Reckenrod's ligament. Below Reckenrod's ligament. This is the broad ligament of the uterus and this is the ureter. And this is the uterine artery. Uterine artery. This uterine artery is very closely related with the ureter. By ligating the uterine artery, there is a chances for the accidentally you may ligate this ureter. That is why you must be very careful. You may, while ligating the Reckenrod's ligament, removing this cervix of the uterus, you may cause damage to the ureter. That is why you must be very careful during hysterectomy with the ureter. That is the most common complication of the hysterectomy. Post-hysterectomy, there is damage to the ureter. If there is a damage to the ureter, at this level, you try to anastomose with the opposite ureter, or if you damage ureter, or suppose if you damage the ureter at higher level, suppose if you damage at this level or higher level, you try to anastomose with each other. Okay, or sometimes you may put this ureter into the sigmoid colon. Okay, that is why you must be very careful with the ureter during the pelvic surgeries. That is why this is very, very important. Next part is the intramural part. Intramural is a very small part within the wall of the urinary bladder. It is obliquely arranged. This arrangement of this intramural part of the ureter is very, very important to prevent the regurgitation of urine, the reverse flow of the urine. Because of this reason, it is oblique in arrangement. Okay, that is already Laplace law. That is resistance to the pressure, gradient to these are all. Here the resistance of the lumen, radius of the ureter, when the bladder is full, it is almost zero. That is why the resistance is infinite. Because of this reason, there is a prevention of reverse flow of urine from the urinary bladder into the ureter. That is the most important thing. And here the ureter is also supplied by this T10 to L1 segments of the thoracic sympathetic chain. So thoracic and lumbar sympathetic chain. Because of this reason also, if there is a calculi in the ureter, also it produces radiation of pain from line to line. That is also another important clinical aspect. Okay, and especially you must be very careful during the hysterectomy. During hysterectomy surgery, you must be very careful with the with the damage to the. There are more chances for the damage to the ureter, especially the pelvic part, especially the second part of the pelvic part of the that is the importance of this ureter. And blood supply at the ureter receives depending upon the area. Receives the blood supply from different parts of the body. That is the body posterior abdominal wall. That is, you see here. This is the renal, receives the blood supply from the renal artery. It also receives from the gonadal arteries. It also receives the lumbar arteries and from the peritoneum and from the internal iliac artery, and vesical branches also use. And it also receives branches from the peritoneum. Because of this reason, during the abdominal surgery, unnecessarily you don't avulse the peritoneum from the ureter, because it may lead to avascular necrosis of some region of the ureter. Because to prevent this one, you must be very careful with the avulsion of this peritoneum during abdominal surgeries. That is also very important. Okay, that is about this. Sometimes there may be obstruction to the urine. Here, another important point is having three constrictions. That is, one is at the junction of the abdominal part and the pelvis of the ureter. And next is at the level of the internal iliac artery or external iliac artery. That is the bifurcation of the common iliac or external internal iliac artery. At this level, there is a constriction. And third one is at the junction of the abdominal, that is pelvic part and intramural part. That is, this is also very here. Out of these three constrictions, this is the narrowest area, narrowest constriction, and it is the most common site for the obstruction to the caliculi. That is ureteric caliculi. That is this is the most common site. Okay, these are all the points related with the ureter. Next, coming to the other topic, that is the posterior abdominal wall. Posterior abdominal wall. The posterior abdominal wall is also important. The posterior abdominal wall, it is a osteomusculofacial. Osteomusculofacial. That is, osteo means it is formed by bones. Musculo means it is formed by muscles, and fascia is also taking part in the formation of the posterior abdominal wall. Because of this reason, the posterior abdominal wall is osteomusculofacial, and it extends from the last rib to the pelvic rim. Extend from the last rib to the pelvic rim. Okay, it is composed of bony part, muscular part, and facial part. What are the bones which are taking part? What are the muscles which are taking part? And what are the fascia which are taking part in the formation of the posterior abdominal wall? We see. Okay. Next, you see here, this is the posterior abdominal wall. Posterior abdominal wall. Here, osseous part, that is the bony part, it is formed by lumbar vertebrae. and intervertebral discs. Lumbar bodies of the 5 lumbar vertebrae, and this ala of the sacrum, ala of the sacrum, ala of the sacrum. They are also taking part in the formation. Okay, these are the bones which are taking part in the formation of the posterior wall. That is the bony part of the posterior. And both sides of this bony part, this is the midline. On both sides of these, they are formed by muscles, that is muscular part. Here, the muscles are most medial muscle is the psoas major muscle. Sometimes there may be chances for the psoas minor muscle. Mostly, psoas major muscle. Just later to the psoas major muscle, there is another muscle, that is quadratus lumborum. Quadratus lumborum muscle. And just later to this quadratus lumborum muscle, there is a transverse abdominis. Transversus abdominis. Transversus abdominis. And in the lower part, that is iliacus is also taking part in the formation of the posterior abdominal wall. Okay, so these are the muscles which are taking part in the formation of the posterior abdominal wall. Posterior abdominal wall. And these muscles, they are also covered by fascia. It is here surrounding the psoas major muscle is covered by psoas fascia, and iliacus muscle is covered by iliac fascia. Usually we call it as iliac fascia. The muscle, the fascia which is covering the psoas major and iliacus muscle in the pelvis, we call it an iliac fascia. It also extends over the psoas muscle. Here we call it as psoas fascia. And quadratus lumborum and transverse abdominis, they are also covered by fascia, that is anterior layer of the thoracolumbar fascia. Anterior layer of the thoracolumbar fascia, especially lumbar fascia, because it also extends into the back of the thorax also. That is why it is called thoracolumbar fascia. At this level, there is only lumbar fascia. Only lumbar fascia. These are all the fascia which are taking part in the formation of the posterior abdominal wall. You see here, these are the muscles. There is the psoas major muscle, this is the psoas minor muscle, and this is the quadratus lumborum muscle, and this is the iliacus muscle. Iliacus muscle. Okay, these are all the muscles and bones. Next, you see here, what are the structures passing? Here, this is the subcostal nerve, this is the iliohypogastric, ilioinguinal, and this is the genitofemoral. Genitofemoral. PSS the psoas major muscle. PSS the psoas major muscle. This is the psoas minor muscle, and this is the iliacus muscle. Iliacus muscle. And here, the important thing is there is a psoas major muscle is also very, very important clinically, because this is the muscle. It is clinically it is important because sometimes there is chances for the formation of abscess. Psoas abscess, because it is covered by a iliac fascia. Iliac fascia is closed on all the sides, and if there is a formation of pus, this pus may be gradient downwards, and it may spread along these nerves into different parts, to the knee joint, to the femoral triangle, to the ilium, there is a pelvis. Okay, and posteriorly along the sciatic nerve of distribution of the up to the heel, the pus may be spread due to the formation of tubercular abscess. That is the lumbar lesion. Lumbar vertebrae may affect by the tubercular bacilli. It may produce tubercular abscess. Tubercular abscess. That is why the psoas muscle is very, very important. It takes origin from the lumbar vertebrae, bodies of the and intervertebral discs or arches of the in between the two bodies of the lumbar vertebrae, and it runs downwards and laterally, and it crosses the pelvic rim. Then it enters into the pelvis, and then finally it reaches to the lesser trochanter, tip of the anterior surface of the lesser trochanter. That is the insertion of the psoas major muscle. Psoas major muscle. Here the psoas major muscle, in the pelvis it passes along with the iliacus muscle. The psoas major muscle, the function of the psoas major muscle is mostly it is a flexor of the hip joint along with the iliacus. And suppose if it is on the ground, it is a medial rotator, off the ground, lateral rotator of the hip joint. Okay, these are the functions. The nerves which are supplying to the psoas major muscle is the L3 and L4 spinal nerves, directly branches from the lumbar plexus. Lumbar plexus. Okay, these are the structures. Next, this is the quadratus lumborum muscle. It takes origin from the iliac crest, and it gets inserted to the lower border of the 12th rib. Lower border of the 12th rib. Okay, this is the iliacus muscle. quadratus lumborum muscle. Okay, quadratus lumborum. It also inserted to the sides of the vertebral bodies of the lumbar vertebral bodies lumbar vertebra. Okay, and next coming to the another important topic, that is thoracolumbar fascia. Thoracolumbar fascia. It is very important here. In the lumbar region, the fascia consists of three layers, that is anterior, middle, and posterior. The quadratus lumborum is enclosed between the anterior and middle layers, and erector spinae muscles are enclosed between the middle and posterior layers. Okay, you see here, this is the thoracolumbar fascia, three layers. This is the anterior layer, this is the middle layer, and this is the posterior. In between the anterior layer and middle layer, there is a muscle. This is the quadratus lumborum. And between the middle layer and posterior layer, there is another group of muscles, that is erector spinae group of muscles. Erector spinae group of muscles. The serratus posterior, inferior, and latissimus dorsi, they are attached to the posterior band of the thoracolumbar fascia. Actually, they are not the back muscles. They are migrated muscles. Because of this reason, they are supplied by the anterior ramus. Anterior ramus. Back muscles usually they are supplied by the posterior ramus of the spine. Posterior ramus of the spine. You see here further, this is the quadratus lumborum, this is the anterior layer, this is the middle layer, and here is the posterior. Okay, this is the middle layer and this is the posterior. Okay, next here, this is the another. This is the here. You see here, this is the psoas major muscle. It is covered by psoas fascia. Psoas fascia. And downwards, it continues as the iliac fascia. Iliopsoas fascia. Iliopsoas fascia. Iliopsoas fascia. Here, the thoracolumbar fascia, and here you see, this is the iliacus muscle. It is covered by iliac fascia. Iliac fascia. And this is the psoas major muscle. Here, at this level, the common. This is the iliac fascia. Covers both psoas major muscle and iliacus muscle. Above the level of the pelvic rim, it covers only psoas major muscle. Psoas major muscle. Sometimes we call it as psoas fascia or iliopsoas fascia. Iliopsoas fascia. Okay, these are the fascias. Next here, the thoracolumbar fascia, anterior layer, middle layer, and posterior layer. The anterior layer, medially, it is attached to the. There is a ridge in the transverse process of the lumbar vertebra. Transverse process of the lumbar vertebrae, and laterally this blends with the transverse fascia, transverse abdominis appendices, transverse abdominis appendices. The middle layer, it is attached to the tip of the transverse process medially, and laterally it blends with the anterior layer, then it continues at the transverse fascia. In the posterior layer, it is attached medially, it is attached to the spinous process, and spinous process of the vertebrae, and laterally it blends with the middle layer, then it continues as the transversalis fascia. Transversalis fascia. These are the three layers of the thoracolumbar fascia. If you want to approach the kidney, you must give incision from first skin, then superficial fascia, then these are the layers. This is a posterior layer, middle layer, and anterior layer of the thoracolumbar fascia. Okay, these are all very, very important. Thoracolumbar fascia, they may ask for the short answer. Okay, this is about the, in brief, about the thoracolumbar fascia, because time over. Okay, and kidney, ureter, okay, different parts of the ureter, and clinical importance of the ureter. Very, very important clinically. And then, sorry, I forgot, the males, the male, here the ureter, it is related with the vas deferens and seminal vesicles in the posterior part of the, or base of the urinary gland. This is the relation with the vas deferens and the ureter in the male. In the female, it is related with the, here in the female again, in the females sometimes there will be levo-rotated uterus, levo-rotated cervix of uterus. That means the uterus is rotated towards the left side. If there is a levo-rotation of this cervix of uterus, it is more closely approximated with the ureter. In this region, in this levo-rotated uterus, you must be more careful about the because it comes very close relation with the this ureter. That is the other important point. Okay, these are all the relations These are the points related with the that is today's topic, that is kidney, ureter and posterior abdominal. To study in detail. If you have any doubts, discuss that. Okay. Thank you. Thank you very much.